Podcast.
Welcome to the Pep Talk Podcast, where you can earn continued education anytime, anywhere. I'm your host, Michelle Andrews. Remember, if you want to earn continued education credit, you can purchase the course quiz from the show notes. You must pass the quiz to download your certificate of completion that you can keep for your records. These hours are Tisha CEUs for my Texans, and also for Asha, they count as professional development hours. We are going to learn about empowering bilingual families in early intervention. My guest with me today is Martha Boiardt. Hi there, Martha.
Hi, Michelle.
Hi, I'm so happy to have you here. I'm going to give a little bio about you. Martha is a bilingual pediatric speech-language pathologist, private practice owner, and published author with Bilingual Speech Publications, where she creates Spanish language materials to support culturally responsive care. She is the founder of Miami Speech Therapy, offering concierge in-home and school services across Miami-Dade County. The daughter and granddaughter of Cuban refugees, Martha is passionate about empowering bilingual families, especially those raising neurodivergent children, to embrace their culture and advocate with confidence. Her clinical work focuses on early intervention, speech sound disorders, feeding and myofunctional therapy, and parent coaching. When she's not working, you'll find her crafting, reading, or enjoying life with her husband and 3 kids. Before we start the course content, walk with me through the virtual exhibit hall and take a look at this episode's sponsor, which is Martha's very own multi-syllable word deck with Bilingual Speech Publications. This deck is awesome, you guys. It is for our bilingual kiddos or Spanish-speaking kiddos, and it has 78 cards and 281 total targets ranging from 2 to 6 syllables, Martha, is that right?
2 to 5.
2 to 5 syllables, which is amazing. So if you'd like to just show it and demonstrate it for a moment, and we'd love to see it.
Yes, so here is the deck. Its
Beautiful.
official title is in Spanish. It's Silabación de Palabras Multisilábicas. And so what that is basically syllableness of multisyllabic words. And so I noticed that there was kind of a lack in quality Spanish language products, and the Spanish language has very long words. And so one of the misconceptions that I come across very often, I live in Miami, Florida, in a bilingual community. One of the misconceptions I come across very often with all these families raising bilingual children in bilingual homes is that they think if their child has the signs of language delays and all of that it's easier for them just to speak English to them, where that is not necessarily true. That is not true. So I wanted a quality product that could empower families to use more longer multisyllabic words in Spanish. And so that's what brought us to this product. So we have several categories. These would be first in the back of the card, you'll see the word in Spanish and then the word in English, because a lot of times you'll have an English-speaking SLP who ends up with a Spanish-speaking SLP on their caseload, and a translator is not always available. So each one will have the word, you'll have the word on the back, and then there'll be pacing dots. So like this word, for example, is bebé, or the one I was demonstrating before, because I'm holding the pile. This one is jugo, right? So you have the pacing dots here. You could point jugo, and that is juice, right? So there you have a very colorful, easy to look at illustration of someone drinking juice. So once you get through the 2-syllable words, because funny enough, Spanish doesn't have a lot of 1-syllable words. You'll have like un to say like one item, but there's not really a lot of them. Then you go into the 2-syllable words. Once they have those, you can move into 3-syllable words, but then you use a chaining strategy to get them together. So for example, here you have the word for sunflower, girasol. So I have the compound of it. This is the word gira for turn or twist. And then you have sol for sun. Then when you put them together, you have, let me hold it properly, girasol. And then they can chain it into girasol.
That's awesome.
So yeah, so you can implement different strategies, and this child can produce 2-syllable words, obviously 1-syllable words, put it together, chain them, say a little faster. We have girasol, and now we have a 3-syllable word. And that chains up until we get to 5-syllable words. And so here's one for puzzle. We have rompecabezas. And so the compound included in that is rompe for break and cabeza for head, because that's what a puzzle is, right? It's a head breaker. Okay. So we have rompe cabeza and then you chain it into the big word, rompecabezas. And then, and then after that, those are the categories I have for the chaining strategies. And then after that, I have, a whole stack of just 3-syllable words that you can say without the compound word part of it. Zapatos, that's 3-syllable words. And then we have a 4-syllable word pile and a 5-syllable word pile. So helicóptero for helicopter, and that would be, 5. So, and there's several of them. So that's really the whole thing behind the deck, is getting everybody empowered to use those bigger words, because that just because a child is presenting with language delays for whatever reason it may be, does not mean that you need to completely omit the Spanish language if that's important to that family. So yeah, that's the deck in a nutshell.
Thank you. I love seeing the demonstration. And those of you that happen to not be watching the video, if you're on Spotify, the video is on there. If you're on, you can also find it on YouTube. But what she was showing, these beautiful, colorful pictures, and they have these little dots. Those were the pacing dots.
Yes.
And that 2 of the cards would pace into another card that had the full word. That's so cool. I've talked with you about this deck quite a bit. I actually didn't know that it had the pacing part about it. It's way more than just a deck of a bunch of multisyllabic words. There's a lot more to it.
Correct.
That's really, really cool.
Yeah, I wanted to make it strategic so you can actually look at it and know how to use it.
Yeah, very cool. And then I like how it does have it in English. So if you have, an SLP that needs to read it in English to feel confident in what the word is. Very cool. Very cool. Well, thank you so much for sharing that with us. I will have a link to that in the show notes. If y'all want to go run and grab that, it's awesome. All the Bjorn stuff is great too. I have a bunch of their stuff. It's wonderful.
Yeah. Big fan.
Yes. All right. So let's get into the course content. Before we really get into things, we need to go over our financial disclosures. Mm-hmm. Martha's financial disclosures. She is the owner of Miami Speech Therapy, a pediatric private practice that conducts bilingual speech, language, and feeding therapy in Miami. She also earns compensation for Spanish language consultations and percentage of the sales of her products with Bjorn Speech Publications. She is in the process of developing a course centered around empowering parents to take charge of their child's care, and will be presenting on this topic at FLASHA 2025. So that's Florida's State Association.
Correct.
Conference. Awesome.
Yes.
Martha's non-financial disclosures, none. My financial disclosures, I have a Teachers Pay Teachers Boom Learning store under Pep Talk LLC. I'm the founder and manager of the Pep Talk Podcast. My non-financial disclosures, Speech Arcade is an in-kind sponsor for this podcast. The learner objectives for this course are, number 1, identify 3 key components of a whole child approach in pediatric speech therapy. Number 2, describe how oral motor therapy can be integrated into early intervention. Number 3, explain one thing you can tell a bilingual family to empower their bilingual early language journey. All right, time to get started into this course.
All right.
Martha, let's quickly address the most asked question that I'm sure, and you touched on it a second ago, but the most asked question about bilingual families related to speech delays or just speech development at all. And the question I hear all the time is, does speaking more than one language cause language delays? I get asked this often. I'm sure you do too. Tell me your take on this.
I was just asked this question twice yesterday. So this comes up so often. And I almost went into a whole tangent while talking about the deck earlier. So let's get into it. No, speaking more than one language does not cause speech and language delays. As a matter of fact, if you have a child who's learning multiple languages and they say, for example, apple and manzana, then that's 2 words that they have to describe one object. It's like saying that we're not going to teach a child synonyms, words that mean the same thing. So it's one of the things that they just grind my gears so much, because it makes me so angry, because I live in a bilingual community. Here in Miami, Florida, I have, Cubans, Venezuelans, Colombians, Argentinians. I have so many families from so many different Latin American countries, and they get here and then they think, oh man, the child is in the United States, they need to learn English. And yes, of course, we need to learn English, and their schools are in English. But then the parents are thinking they're going to be confused because we speak Spanish at home and they speak English in school. Well, fun fact, I only spoke Spanish until I was 4 years old. My family, as we mentioned before, my family is Cuban. So my parents and grandparents came to this country many years ago. And then I was born here in Miami, Florida. And in my home, we spoke Spanish only until I went to school. When I went to school at 4 years old, I learned English. That my mother credits school and Sesame Street with teaching me English. So I learned English that way, and then I became a fully bilingual. I'm bilingual, biliterate. I can read, speak, write in English and Spanish, and so I was able to become fully bilingual and all of that. As a result of being fully bilingual my whole life, I was able to maintain a very close relationship with my grandparents. My parents, of course, were bilingual. My grandparents became bilingual eventually, but my grandparents were more comfortable speaking in Spanish. So the thing that I really like to drive home to families is, who is your support? You have teachers, you have adults that come in and out of your child's life for a year at a time, for a small portion of time, for a season. We all have people that come into our lives for a season, but your village, the people who support you and raising your child, are your family members, in ideal circumstances, of course. So if my parents just said, okay, no, you have to speak English only, then that would have cut my grandparents out of my life. And really, I had phenomenal relationships with them because I was able to just sit there in their homes and talk to them at length about where they came from, the struggles they went through, and all of that. It made me a better person. So when it comes to our neurodivergent kiddos or our kids who are struggling to learn a language or speech delayed and all of that, and are struggling to communicate, I want families to understand that you don't want to cut out an entire subsection of their lives because it's so important. Imagine now you have grandma taking care of your kids, but then the kid gets hurt and they can't tell grandma what happened because they can't speak that language with them. So I really, really, really drive home to families that if you have monolingual Spanish or, whatever other, this applies to all the languages. If you have a monolingual grandparent who speaks your heritage language, you want your child to be able to communicate with them. So that's kind of the hill I'll stand on, the hill I die on.
That's huge. That's, if they, like you said, if they only then decided, okay, well, we're only going to speak English, that's going to be isolating to them, especially if maybe other siblings or cousins are having all these conversations with other family members and they feel left out. And there's just so many frustrations there that can happen, especially when there's so many studies that debunk that entirely, that it does not cause language delays.
Get into the science of it, like you brought up. There's research upon research upon research saying how it only increases their vocabulary, about how it makes them like code switchers who go between English and Spanish. They become more fluid of mind and can actually process math problems a little bit better. And so there's study upon study that is just showing the benefits of bilingualism. And that's just not even touching on the part that I spoke about, which is the day-to-day life struggles that people have. So when I hear this antiquated, incorrect advice to, hey, you're going to confuse your child. No, you're not. Just yesterday, I had a conversation with a very well-educated woman whose grandchild is struggling with speaking. Just they're an early language learner, and they're trying to figure out what's going on and all of that. And she says, well, his teacher at school speaks to him in Spanish. Well, if that was the case, if the child is in fact language delayed, they're going through the process to get evaluated and all of that. But if they were not language delayed, let me rephrase. If they were not language delayed, then they would be coming home speaking Spanish because they're exposed to it. But if the child is just not talking at all, then you have to evaluate what's going on, because they should be mimicking what they see, whether it's English at home or Spanish in school. Some of these kids, I have seen it here in Miami before, where you have a family that comes in from the Midwest or whatever, they move over here for work, and their child goes to school, and the teacher speaks Spanish and English and a mix between the two, and they have Spanish speaking peers, and those kids come home speaking Spanish. That's what happens. So the confusion is not there.
Yeah.
So if there is a language delay, that has to be investigated separately.
And that's separate. They would have that delay regardless. It has nothing to
Regardless.
do with what language, how many languages, etc. Yeah, definitely. This is a big one. I don't even specifically work with a lot of bilingual families. I know you do specifically, but still, I encounter it from here and there, and all the time. Everyone asks that question. And I'm just like, no. It's not the case. It's not the case. Especially just my own experience. I wish I had a time machine to change this, but I really didn't learn any. I live in Texas, and I didn't really learn any Spanish at all until college. Even in high school, I took French for some reason and didn't learn a thing either. And then when I got to college, your brain just doesn't have that plasticity anymore. I could not learn it to save my life, and
it's harder.
It was so hard. I mean, maybe if it was my one goal in life, I could have done it, but it was very hard. And I was just thinking, if I would have learned this when I was younger, kiddos, when you're young, your brain truly can learn a language more, easier.
Yes. The neuroplasticity is so much, it's so much easier when they're little, but
so it's like, if
it can be done when you're older too, but
it can be done, but
it's more of an effort.
It's like, if you can do it, like, definitely do not discourage that. That is a lifelong blessing to be bilingual. It's amazing.
100%.
So, everyone encourage that as much as you can. We're going to, it's our mission to debunk that everywhere. So, all right. So let's dig into the whole child approach. Can you get into kind of what that looks like for us?
So, like you said before, I am the owner of Miami Speech Therapy. It's my private practice. Right now, it's just me, but we're growing now. And so one of the missions that I am on is to have a whole child approach when I see children. There are a lot of times that we as speech pathologists are told, you have to pick a niche. You have to pick a niche. You have to be the person for blank, right? And so when I was really getting into my private practice, the majority of the clients that I ended up getting were early intervention cases, which is like the birth to 3 population. So a lot of and what is early intervention? Early intervention is an age range. It's not a niche per se. So it's not feeding, it's not speech sounds, it's not communication, it's an age range. So becoming an early interventionist means that you kind of sort of have to be a bit of a generalist. And I felt this pressure to say, like, well, let me pick this niche, let me pick this niche, let me pick this niche. But I kept getting, as a small business, you get the client that's in front of you, you take them and you become the expert on what needs to happen with that child. And so that was something that I personally struggled with. I know other therapists don't struggle with the same thing, but that was my personal struggle. So what I started realizing is that there were kids who were in therapy and other places where they kept missing something and they weren't making progress because of this one thing. And what is it that they were missing? Then I would see another child who was like, they're trying to speak, but something's going on and they don't understand what's happening, but the child's throwing these tantrums and we don't know what's going on. So all that to say that I realized that there's so much value in being a sensory informed speech pathologist, so that you can see what is it that is going on with this child, because behavior is communication. So what is it that's going on with this child? They're humming a lot, or they're flapping their hands, or they're constantly moving. They can't stay seated. Okay, so becoming sensory informed became very, very important. And I became very successful being a sensory informed speech pathologist. But then I ended up with this little girl who, had been through some traumatic events in her life, had been rehomed and then adopted. This little girl was blessed with this amazing family, but that was after going through a lot of trauma. So we had to kind of sort of tease out what's going on here. And the background on her was a bit unknown. So I had to look at her sensory. I had to work with the family, the social worker, and all of that, and see what's going on. But then I realized that there was something going on with her mouth. Something was a little off. She was sitting in her seat. She was paying attention. They thought that she was delayed, but really she was communicating quite well. So what was going on here? What was off? And I realized, her bite is very strange. The way the tongue sits in her mouth is very strange. What's going on here? It's not your neurotypical, So I started becoming a little bit more informed on myofunctional therapy and did training about almost 2 years ago now on, becoming an orofacial myologist through Simon Says Speech. And so I said, there's a lot to be said for being both myo-informed and sensory informed and neurodiversity affirming. If you have those three things in your wheelhouse, you can take a child in early intervention and move mountains with them, because you really set those parents up for success on what to do for their child. Because sometimes it's sensory and you need to bring an occupational therapist in. Sometimes it's myofunctional and you need to, okay, let me say myofunctional therapy is really for ages 4 and up. But if you start to see early signs of myofunctional disorders, you can work on feeding. You could bring in an airway-centered dentist. You can bring in an ENT. And now suddenly, bam, we're moving mountains with these kids. So that's, I can't say in a nutshell because I went on for a while with that, but that is my whole child approach. I like to look at the whole child and see, hey, what is going on and where do we need to go and what specialist do we need to bring in? Because sometimes it's not just me. It's not just the speech pathologist that has to be involved with this child. And parents don't know where to look unless someone tells them sometimes, because we don't get a manual. We get these kids, they give them to you in the hospital and they say, good luck. We don't get a manual. So that's what I aim to do.
I love that. And really, I'm kind of in the same boat. I have my private practice and I do get a lot of the 3 and unders, or really a little older than that too, but a lot of 2-year-olds, a lot of 3-year-olds. And that's very true. We need to take on the responsibility of referring out when we need to, looking at the whole child. If we get a child and it's like, oh, okay, they're not talking and we just write these goals for just to drills or, play based, whatever, like just language, we really got to look at the whole child.
Yep.
I actually did the Simon Says courses too. And I've been doing some other ones too, and just really diving into that. I did the TOTS course with
me too.
And I'm diving in too. Because once you know a little bit about it, you're like, oh no, I got to learn it all. This is huge because there's so many kiddos that I've seen. Maybe it's speech sounds, maybe it's whole language, and I look under their tongue or I see that their bite is all crazy and it's just, there's just more going on. It is not just language.
It's amazing. Once you see it, you cannot unsee it. Suddenly you're in the grocery store and you see these mouth breathers and you're like, oh my God.
Oh, I can't go anywhere. Airports, church, public places at all are just like, oh no. And then it's like, you want to tell them, but it's like, how rude would that be? Hey, see that you're breathing with your mouth open and you have a overjet. I bet your sleep's terrible, isn't it?
Yeah. I bet you snore, huh?
I have included in my intake form, I really do. I'm asking most parents or all parents now about their sleep, about feeding, of all these things that kind of is more of that whole child of let's look at everything. I don't want to just know, okay, Johnny can't say XYZ or whatever. Like I need to know the whole picture because there is exactly like you said, there's just often more going on. It's good to have, a good referral list to maybe an airway-centric dentist. ENTs, love-hate relationship. I don't know. It depends on the ENT.
Yeah, it depends. It depends on the dentist too.
Yeah, yes. It depends. I would get to know some in your area so that you feel confident. You feel like y'all are aligned on the same things. And that way you really feel confident sending patients to
we've talked about this in the past, but we're both moms, and I have 3 children, and my children was seeing this dentist who's just very highly regarded here, very highly regarded. I said, my children are going to go to the best dentist with the best reputation, of course. And so I took my children to see him, and nicest man, just such good care and all of that. And then I started to become more myo informed, and I got so excited. I was like, oh, wait till I go see him. I'm going to go talk to him. And so I talked to him and I said, okay, so here's what I'm noticing. And I started noticing issues with my own children that I had not seen before. As a speech pathologist who has been in this field since 2007, and I had not seen these issues before, and I bring it up to the dentist and he completely brushes me off. And I asked him very specific questions and he got very dismissive. And I said, okay. I didn't know where to go from there. Where do you move on from there? Like you have the dentist who everyone goes to and everyone loves, and every influencer here in Miami talks about this man. I went, okay, I'm going to start asking around in my community and I'm going to start doing some research. And I found the one airway-centered dentist here in Miami. And he did assessments, he did CAT scans, he did pictures, measurements, you name it. My children had it done. And we found three very unique issues with all of my children. And long story short, they just started palate expansion this week. So
my daughter has one too.
So I am on a myo journey with my own children times 3.
Yeah. Oh,
Yeah.
I totally can relate. Yeah, my 2 oldest need palate expansion. We're thinking my third might not need it, but she's a lot younger, so we'll see. I'm on a journey with myself too. I feel like we could talk about this for a long time, but just
We really could.
It's important just to know, because once you learn, you're like, oh no, it's just a whole rabbit trail. But yeah, I have a tongue tie. I sleep with my mouth open. I wake up with my jaw hurts. I have a lot of red flags. So
Same.
I
Me too.
went to an orthodontist, and I might be doing expansion. He was thinking I could get expansion without the whole MARPI, which is the screws, and it's a little more
The screws in the palate, it's very invasive.
Yes, sounds a little painful, but it'd be worth it in the end. I know a lot of people have done it. But he thought he could get enough with braces, not Invisalign. Invisalign would not do it, but braces, that he thought he could do it. So I'm interested in maybe looking into that, because then once you even know, even on yourself, you start looking at your smile and all the things, and you're like, I have, these, like, my teeth could go out more and all this stuff. You just can't stop once you know.
And you see now people our age, I had braces in middle school, and you see people our age and having orthodontic relapse and sleep apnea and all these things, all these issues that our generation is suffering from. There's solutions to, if you work on it in early intervention.
Yes.
If you work, like, we can prevent our own children from having the issues that we have now. Because I'm on a myo journey for myself as well. Like every mom, I'm focusing on my kids first, because they're in that early intervention window.
Yeah.
So, which, I mean, I know earlier I said early intervention for speech pathology is really birth to 3, but my children are, my oldest is 11. So I'm trying to get to before the teenage years doing this myofunctional intervention on my own children, so that they don't suffer through some of the issues that my husband and I do, because and then I'll focus on myself.
Yeah, but just like the whole child approach in therapy, we can't be afraid to tell parents what we see. A mom, if we as SLPs are just now kind of digging more into this and taking more courses and learning more, of course, most moms and dads out there know next to nothing probably about that. So they have no idea that maybe there's some reason why their kid keeps waking up all throughout the night, or won't. There's so many different signs that seems common, even though it's not correct or how it should be. There's lots of things that parents just shrug off, like, oh, well,
just because it's common doesn't mean it's normal.
Right. Yes. So it's not normal, and there's lots of parents. Yeah. And there's lots of kids and even adults that struggle with certain things, but that doesn't mean that that's how it should be. And there's things that you can do. So when it comes to the whole child approach, don't be afraid to say something. You might be the only one that has the opportunity to say it. Because there's a lot of great pediatricians and a lot of great dentists, a lot of great specialists out there, but sometimes they're not seeing that kid as much as you do. If they're on your caseload and you're seeing them weekly, twice a week, even sometimes, like, you're a huge part of their journey. A pediatrician might ask great questions. They might get to the bottom of it, but if it gets slipped, if they don't, you could be really helping that child and that family.
Yeah. And there's, off of what you were saying, there's so many times that you have a pediatrician or a physician of any kind of specialist, and they care so much, and they ask the right questions, and they do all the right screeners and all of that. But then a lot of these screeners are yes, no questions. And you and I know that a lot of these answers are not yes, no answers. Sometimes they're answers. So they're so great. These screeners are so amazing for flagging these really extreme cases, but there's those middle of the road cases that fall through the cracks. And I feel like those are the things that therapists are more skilled at finding, because we're seeing them in the day-to-day. And when you see a child for an hour at a time in their home, in their school, and you see what the day-to-day struggles are, then you see the where it could be a yes, where you thought it was a no. And so physical therapists, occupational therapists, speech therapists, respiratory therapists, we really focus on helping that child thrive every day, and so I feel like you kind of need both aspects of it. You need your physicians, because your physicians are the ones that catch these things from the get-go. but you really need your therapists as well to, just help that kid thrive. And when you have that whole thing, it's kind of that the whole child thing. No one person, every doctor, every therapist, they're human beings, right? No one person can know everything. So that's where I love to get teams together.
Yes, that's very important. I want to hear more about the whole sensory aspect of the whole child approach that you do. Is there a certain screener you use or a certain, I don't know, tell me a little bit more about that. I feel like that's something we can all learn a little bit more from.
It's funny because you say, oh, is there a screener you use? My 15 years of experience, pretty much. Like I see a child who's wiggling around a lot and I'm like, hey, I know that this child is not going to be one that's going to sit at a desk. So we're going to sit on the floor. We're going to lay down. We're going to jump up and down on a trampoline. We're going to bounce on a ball. So my sensory approach is really like, let's be up and down. I have parents who tell me all the time, my child can't do speech therapy for an hour. And I'm like, your child can exist for an hour. They can do speech therapy for an hour because I do not sit them down and drill sounds for a whole hour. We blow up balloons and we throw them in the air. We play keepy uppy and all of that stuff and work on keeping your tongue up, lips closed, breathing through your nose while you're doing it. So that's how I implement a lot of sensory is when I see if the child is fidgeting, and I don't see tantrums as a negative thing. Of course it's negative, it's unpleasant, but I see behavior as communication. So when a child is going like, God, I don't want to do this anymore, it's because it's gotten hard. So I pull back a bit, make it fun, turn on music, play freeze dance, get back to it. And like build up to there. But when you see it, you're pushing a child's tolerance, that's when you have to pull back. And I always make sure to inform the parents. Like if the parents are telling me like, have they gotten their R yet? And the answer is no, I have to say why. Because here is where they are. And here is where I have to, boost them up, bring up their confidence a bit, and then get back to it. Because so I use sensory approaches to guide my sessions.
I love that. It's really kind of an art in a way.
It is.
Of like a child, and then kind of knowing when to push, when to pull back, because you're right. If you are just push, that kid is going to push right back, and
it's intuition.
Fun, and once it becomes stressful, like you're not in a learning state, that not at all. So really being aware of that, I think, is key. And some of that might take practice. If you're a new SLP, that might sound scary because it's like, no, just give me an answer. But I think the more you see it and the more, and you can tell, just be looking for those signs. Like, is this person, kind of shutting down even? Maybe it's a silent thing, or maybe it is more of like then it's a toddler crying on the ground or something, or throwing
something. I had a baby that I'm working with now in his preschool. And I work with the teachers and I send videos to the parents, and I'm in constant communication with teachers and parents and all that to make sure that we are working to helping this child. But the teacher was telling me like, he's really, every day he pushes his body into other children. That's a problem, because think about that child's parents don't want their kid being pushed into. And so that's not okay. We have to teach children that like, it's not okay to push into someone else. But now I have to ask, why is he pushing so much? Why is he shoving his body into other surfaces? Because maybe he needs some proprioceptive input, and we need to get an occupational therapist involved here. And so I was giving from, like you said, the years and the intuition of knowing, because you've been doing this for so long. So I have worked and collaborated with so many occupational therapists that I have some strategies under my tool belt, but I try to educate the teacher, and I say, okay, like maybe he needs some compression, some big hugs. And I, try and educate them that way so that they give them that proprioceptive input. And then immediately I'm telling the parent, here's the complaint from the teacher. Here's what's going on, how it's affecting other children. Here's what I told her, but we need occupational therapy, because if this child needs more of a sensory diet, we got to get someone else in the team. So I can't remember what your exact question was. I hope I answered it.
It was great. So I was like, yes.
I hope I answered it. I'm sorry.
Yeah, no, I wanted just like more of just your insight on that whole topic. So that was great. The next thing I wanted to ask about was another part of the whole child approach, especially when it comes to bilingual children, is their culture. And so that is when you have a kiddo come in, that's huge to them. Like, just think about your home life, whatever culture you're in, that kind of thing. It needs to be it needs to be a part of
Yep.
your therapy plan. It needs to be something that you're aware of. So tell me more about what you do for that.
I have plenty to say about that. And for anyone listening, I am Cuban American, so I can speak from the Cuban American standpoint of like cultural responsiveness. But it kind of carries over into most Latin American cultures as well. But yeah, there are some very held beliefs that are cultural. Let me back up a little bit. If you and I, as educated and successful as we may be in our current lives, had to uproot and move to another country where they did not speak the language, you and I would become the disenfranchised population. We would become the minorities, and we would be dealing with some very significant challenges. So when you have somebody who comes from that, who maybe had to deal with some level of poverty, some level of food scarcity, those types of challenges, doing feeding therapy, where you want the child to do a lot of sensory play, and we end up throwing away a lot of things. That's tough for some of these families, because I'm trained in the SOS approach, and the SOS approach is amazing. And it deals with having the child interact with the food, touch the food, smell the food, tolerate it in their proximity, and then, roll it on their arms and whatever. And we're not always getting to eating that food that day. But what do my Cuban grandparents want is for the child to eat that day and not throw it away, because they worked really hard to get that food. And so that is a huge thing that I have to deal with. So what I do a lot of times is I strategize with these families, and I say, hey, if this is something that we're going to use for food play, let's get some Tupperwares, let's save it so that we can, keep it in the fridge or whatever, and then we can keep doing it. I have to educate them a lot on sensory systems so that they see the benefits of it, but then I have to meet them halfway. Like, if we're dealing with food scarcity and all this stuff, then we can't be throwing away so much food. So that's one of the things that I have to deal with that's one of the things I have to deal with when it comes with, that I have to be sensitive to when it comes to feeding therapy. When it comes to speaking, communication, possible neurodivergent children, and I have to, like, they want everything to work exactly like they want it to work. So the child's not talking, they want them to talk today. And I wouldn't say so much that's cultural responsiveness, because I think that's I think that's everybody, but there are wide held beliefs in my culture where it's like, because I said so, because, this is what it is, because this is what I expect, because this is how I was raised, and because, and if you're dealing with a child who's about to be diagnosed with autism and who's about to be identified as neurodivergent, then I have to really start from the beginning and educate them on sensory systems and how we learn and how we perceive the world around us, and really like advocating for that child, because you don't want the child to grow up with trauma because the families are pushing them to talk earlier than they're ready to. Because one thing that people think about speech pathologists is they think that we can physically move a mouth and make it talk. We can't. We have to support the environment in order to facilitate that. So for a lot of families who get here to the United States and struggle, I'm sorry, I'm moving my desk, get here and struggle, and they're worried about very primary things like survival, like putting a roof over the head, putting food on the table, all those things. This is what families are worried about. So now you have to worry about, are we supporting that child correctly? And that's not a survival skill. That's a thriving skill. That's something. There's a lot of cultural backlash that can happen from that, because they're not used to having to deal with that kind of thing. 'Cause surviving is one thing, thriving is another thing, and you need both. Yeah. And yeah, that's one of the things I deal with. So with bilingual families, I have to get down to the basics and explain it to, at least in my case in Spanish, I have to get down to the basics, explain everything again in Spanish, go from there.
Yeah. That's so important to learn more about other cultures. And really that might be kind of a good starting spot, is maybe speaking to families of other cultures, maybe doing some research. And then when you do get someone on your caseload, asking questions to learn more if you aren't really educated in that specific culture. Do you have any tips for that, of just learning more about different cultures so that you can know all those things? Like, I wouldn't have known about the food and throwing it away. Like, that's not something I would have just thought about, but that's something that you knew about. Might be maybe asking certain questions or.
Yeah.
Doing that research.
From the get-go, I mean, because you can look at this globally and say like, oh yeah, like let's see what universities are doing research on this topic so we can, and yeah, but the truth is that you don't know that you have those challenges until you have that child in front of you and have to deal with that with this family. So a lot of times I will arrive at a home, like, let me think of a culture I'm not too familiar with. Peruvians have, even though that we both speak Spanish, they have a lot of words that are different from the Spanish that I speak, right? Like where I call a pig a cerdo, they call it a chancho. So there's different words that I have to think of. So when I already go into a house that they speak Spanish, but it's a different Spanish than the one that I'm used to, I right away start going, okay, so tell me about this. Like, explain to me, how do you say this word? How do you, and I always tell them, make sure that if I'm saying something in the way that I'm used to, that you're not used to saying, correct me, please. And I'm open to it. And then I already know that when I go into that house, I got to switch to Peruvian Spanish. It's happened before. I've worked with Peruvian families before. And that's one that's challenging for me because they have very different vocabulary than like my Cuban Spanish is. And then that is true for most, but just Peruvians have a lot of different words. That's why I bring them up. I'm sorry to pick on the Peruvians, but it's true. And then, Colombians have different words than Cubans. Dominicans, Mexicans, they have different words than Cubans. Actually, Dominicans and Cubans are very similar. But Argentinians, they have very different pronunciations as well. So that's something I always try to keep in mind. And I always try to communicate to the parents and grandparents there. I say, hey, caveat, I'm Cuban. So my Spanish is going to be a little bit more Cuban. Please tell me, like, if there's a word that I'm using that you don't use, that so that I can correct myself and present in a culturally responsible way to this child. And so the families are always so receptive. They're so great. They always tell me like, yeah, hey, use this word like this. It's like that instead. Okay, sure, no problem. A straw. Straws come up a lot, and straws are used. The word for straw is different in so many different cultures. You can call it una pajita, pajilla, absorbente, pitillo. There's like so many different words for straw, and we use straws in speech therapy so often. So
yeah, it comes up a lot.
It comes up a lot. Like I'm telling you, and you know how often Old MacDonald had a farm comes up in speech therapy. Pig, straw. These are like the words that I always have to ask the family, what's your word for this? All right, thank you. And then continue.
That's so funny. Yeah. And so just within different Spanish speaking cultures, there's a lot of different ones, a lot of different words that could be used for a certain word.
A lot of differences.
I think, like you said, having an open, going ahead and being the first to say that you would want that open dialogue. I want you to correct me. If I want to respect your culture appropriately, and please tell me. I think that gives that parent that, I don't know, just makes them more comfortable maybe speaking up. Otherwise they might not want to correct you. You're this SLP so you must be right. But it's like, no. I want it to be your culture. Yes, that's really important.
And they're so receptive and they love it so much. And trust me, I get grandmas correcting me all the time. It's fine. I have thick skin. It's okay.
Yeah, you can't get your feelings hurt. Yeah, definitely.
No, absolutely not. Yeah. So they have different, as long as you're the first to say it, like you said, you're the first to say it, you say, hey, this is my disclosure, this is my caveat, like just come here. And the thing is that it all falls into that whole child approach. If we're being a team on this, then you can carry this over and generalize it to the child's daily routine, whether we're talking about food, feeding, or speech sound disorders, or language, just basic communication. This is how we generalize, by educating the families and having the families educate us so that we can give the proper advice. And those are the kids that have the best outcomes. So, yeah.
Yeah, definitely. Okay, I know we were going to get in a little bit more into oral motor therapy and early intervention. I know we touched on it a little bit, but maybe we can get some more examples and kind of a little bit more what that looks like for the early intervention crew.
So for the early intervention crew, I mentioned before that I'm a myofunctional therapist. So myofunctional therapy, like we said, is really for ages 4 and up, cognitively speaking. So some kids maybe have to be a little bit older in order to do a structured myofunctional therapy program. But if you see a child who is maybe on the spectrum, maybe with Down syndrome, or even just a very young child, just different differences, and you see oral motor weakness and all of that, I like to use Myomunchies, which are it kind of looks like a guard, like a silicone night guard, but they can put it in their mouth and it can help train tongue positioning and help train the teeth to go where they need to go. So that's something that you can use in early intervention. There's different brands for it. That's just one of the brands that I'm most familiar with. And it has like little silicone bristles on it. So it also helps with oral hygiene and all of that. I like to use, if it's a child who recently had a tongue tie release or a lip tie release, and, the different massages and stretches, there's different passive programs that you can do for babies and toddlers. You have to be a little bit careful because once they get teeth, they bite. Yeah. So yeah, you have to be careful with that. But with the little ones, oral motor therapy really looks more like feeding therapy and working on getting those hard munchables in, so you can work on tongue lateralization and engaging the biting of the back molars. Because sometimes I think every SLP has seen a kid who chews only with the front of their mouth. So, if you get like a whole carrot and put it in the sides of their mouth, so you get that tongue lateralization, you get that engagement from the back teeth, then that's really what it looks like in early intervention.
Very cool. So it's a little bit more feeding therapy, or maybe using some certain tools. Like, I'm interested in learning more about the Myomunchie. I know I've seen it a lot, heard it's been talked about quite a bit, but
yeah.
What age would be the range for that, would you say?
The Myomunchie goes from infant to adult.
Infant.
Yeah, you have to do a specific measurement, which, I mean, you as an SLP, you can go in on their provider portal. It's free. And I'm not like a sponsored person for Myomunchie.
Yeah, I know.
It's just something that I've used and I like. But I have a child right now who's autistic and a thumbsucker. And so he has a low tongue posture and a vaulted palate. And so because of the specifics involved with this child, he's not ready for like palate expansion or releases. But we're working to remove the oral habit by replacing it with the Myomunchie. That way he gets the sensory input. This is why being sensory informed is important, because the reason he's thumb sucking and self-soothing that way is important. We need to give him a different method. Any child like this, we need to give them a different way to self-soothe. We've seen it in chulery, chewy tubes, any child who's mouthing on their shirts or on their fingers or anything. You can use, chewy tubes or different like things that they can put in their mouths instead that helps strengthen their mouths. And you're doing both things at once. You're strengthening and providing the sensory input that they need. Right. Yeah.
Yeah. This could probably be a whole nother.
We could go on forever. Yes.
Yeah. Oh, goodness. Yeah. And I love how you're including this topic into the whole child approach into early intervention, because I really think that for a lot of kids, oral motor challenges are often there. You got to you kind of need to be looking for that. If you're, just drilling some language tasks, but if there's more going on, you got to look at the whole kid.
100%. And I can work on language while they're doing feeding therapy also. So that's not to say like I'm only doing feeding and I'm only doing language. Like, why not do a session where you are doing feeding and talking about it and using their AAC device to comment on the food that they're, we can do it. We can do all these things at once, and it's more natural. That's just me.
Yeah. Yeah. Let's talk about the food. Let's talk about all the different things. There's so many things you can do at once, which is sometimes I definitely feel like, I don't know, a circus clown, or I'm doing all these things at once. But, once you start doing it, I don't know, just kind of speaking to maybe if there's any new SLPs out there, you don't have to make it harder than it needs to be. Naturalness to, like, kind of, you mentioned, like, it can be natural, just kind of what you would say. What would a kid that could talk more, what would they want to say about the food? And then when we're talking about different cultures and stuff, like maybe there's different aspects of that you could talk to them about, or learn from them, or learn from the parents about while you're doing it. So very important.
I think we should normalize that feeling of like, oh man, I feel like a circus clown, because sometimes you do, and that's normal for us.
With like 12 hands, I need all the things. I feel that way whenever I give the PLS. I'm like, I try to like not give it anymore because it drives me crazy. I'm like,
I've been personally victimized by that purple bear.
Yes, the purple bear. Yes. And then it's like these crayons. Okay, now I'm going to take them away. And, we don't But
here are the blocks. Take away the blocks. Here are the blocks again.
I know that one I most feel just crazy, and I'm like sweating and it's a mess. But just doing feeding therapy while talking about it, while maybe working on a sound, I mean, whatever you're doing, that compared to the PLS will be nothing. So if you can get the PLS, you can probably do more than one thing at the same time.
Yes, you're good to go.
Yes. That can be your practice, but awesome. That's really important stuff. Let's see. Before we kind of wrap up, I really want you to talk about some things that we can tell bilingual families that will empower them during their early language journey.
Yes. Keep going. If I had to simplify it, boil it down, just keep going. Keep speaking to your kids in Spanish, because the more input in Spanish, in the heritage language, because anyone could be listening to this, right? Keep speaking to your kids in the heritage language, because that is what is going to keep that child as a member of your family. And that is going to be more empowering for them in the future. I mean, when they're adults, there'll be more job opportunities and stuff if you can speak to more clientele. So that is, I just don't give up. Just never, ever, ever give up. And this is something that you and I can speak to. Just because there is a language difference does not mean that there is a disorder. Just because there is a sound difference does not mean that there is a disorder. I don't know how many other ways I can rephrase that and say that over and over and over again, because it happens so often where you get a child who, someone is not informed about the, phonological processes and things of that particular language or that particular dialect, and they're flagged as disordered when they're not. They're just different because they're coming from a different background, and that's okay. That's what makes our culture what it is. That's what makes our society what it is, and why we have all these great ideas here in this country. So you and I have actually been working on a project together.
Surprise, surprise, everyone.
Surprise.
Yes, to solve this very problem.
Yes.
I guess, can we say a little bit more about it? What do you think?
I think we could.
Yeah, let's
do it.
We can kind of give a little sneak peek of what's to come. There is going to be a really cool speech sound assessment that Martha and I and another good friend of ours, Adana Burrell, have been working on with Bilingual Speech Publications. A speech sound assessment that will,
take dialectal influence into account.
That will take dialectal influence into account. Yes.
That's right.
It's going to be amazing. Do you want to share anything else about it?
What can we share about it?
That it's going to be awesome.
It's going to be amazing. Like, we have been working together on picking specific targets that will assess phonological processes in English, but then we'll take into account that if this process does not exist, it may be due to a difference, not a disorder. And we're taking into account Spanish language, which is where I come in. And Adana Burrell is taking into account African American vernacular English.
Yes. So this assessment is going to be awesome. It's going to be a great go-to for almost anyone on your caseload. Whether you know that they speak another dialect, whether you don't know if they speak another dialect, whether they just speak your exact dialect and you just like the test.
Yep.
It's just going to be great.
I cannot wait, because already the work we've done on it is this is going to be so exciting. There's nothing like it.
Truly. There really isn't. So it's going to be
It's going to be amazing.
It's probably going to be many months from it actually being ready, but
you heard it here first.
You heard it here first, and there's amazing things coming.
Definitely.
Very cool. Well, thank you so much, Martha. This has been so fun chatting with you. I want to make sure everyone knows where to find you to learn more from you. Make sure you're following Martha on Instagram, Miami Speech Therapy.
Yep.
Also, everyone, now that you have listened to this entire course episode, click on the link in the show notes to get the continuing education credit. There's a small processing fee quiz. Quiz isn't hard. If you've listened, you'll be able to do it. And then you download your certificate. Awesome. Once again, as a reminder, the sponsor for this episode was Martha's very own. There it is, the multisyllabic deck in Spanish from Bilingual Publications. It's amazing, you guys. If you're working with bilingual kiddos, Spanish-speaking kiddos, You need this. It's amazing. So
Thank you.
the show notes. Awesome. And so thank you so much, Martha. This has been great.
Thank you so much for having me. This was amazing. I feel like we could keep talking for another hour. Definitely.
I know. And maybe we'll do another one at some point because this was fun.
That would be so much fun.
When we have our meetings to talk about our Bjorn product, I feel like they're long.
They go long because we have such a good time.
It's awesome. All right. Well, thank you so much for listening. We hope you learned something today. All of the references and resources throughout the episode are listed in the show notes and also listed on the Pep Talk Podcast for SLP's website. Be sure to get your 1 hour of continuing education credit by clicking the link in the show notes. Purchasing and passing a quiz to earn your certificate of completion. If you live in Texas and you are a paying TISHA member, you can submit your TISHA number and receive a TISHA CEU submitted to your TISHA registry. If you are not from Texas and not a paying TISHA member, you can get a professional development hour credit that is accepted by ASHA. Don't forget to check out Martha's Bjorn deck and follow her on Instagram.
Thank you so much for listening to this episode on the Pep Talk Podcast. Remember, you can use this podcast episode for a professional development hour to maintain your ASHA CCCs. You must earn your certificate of completion in order to get credit. This podcast course is also TISHA certified. I live in Texas, so that stands for the Texas Speech and Hearing Association. All the references and information mentioned in today's episode are listed in the show notes. If you have any questions, comments, or concerns, or simply want to chat, please email me or find me on Instagram, Facebook, or go to peptalkpodcast for slps.com. Thank you for joining in and for continuing your education with me.